Welcome to the Real Integrative Medicine Podcast. I'm Dr. Jordan Robertson, and I'm here to bring you the tools, insights, and strategies to take your health to the next level while using evidence-based integrative medicine. What's real? This is what we want to explore together. Research is ever-changing and not easy to interpret. We're bringing you the best that integrative medicine has to offer while sticking to the facts. Our mission is to elevate the practice of integrative medicine for clinicians and patients alike. Preventative solutions, nutrition, exercise, and sometimes supplements have a seat at the table in medicine, but only if we uncover real science-backed solutions. It's time to uncover what works and challenge what doesn't. Let's unlock your full health potential with an integrated approach. Ready to learn what's real? Let's dive in. All right, welcome to the Real Integrative Medicine Podcast. I'm your host, Dr. Jordan Robertson. I have never done this topic on the podcast, even though it's something that I am incredibly interested in and spend a lot of time looking at myself with respect to nutrition and supplements that support fatty liver, which is our conversation today. And I am so grateful to be joined by one of my favorite Instagram follows, actually, Andy DeSantis, who is a registered dietitian up here in Canada with me. We're going to be talking through fatty liver and specifically highlighting some probably experiences that you've had actually through your 30s, 40s, and 50s, if this is something that's come up for you with your doctor, but also if this is a new concept for you, how to approach it with your doctor and what to kind of look out for. So Andy, thank you so much for joining me on the show.
Thanks for having me. I'm very excited for today's chat.
Andy, can you just walk us through sort of what you do, who you are, and how you got to the point in your career where you were like, fatty liver is it for me? This is where I want to spend all of my time.
Yeah, it's a great question. So I'm a dietitian, registered dietitian in private practice. I've been doing this for about 10 years. Was first employed at Diabetes Canada in research and education. And following my graduation from the University of Toronto, where I had got a master's in public health nutrition, and pretty much I always realized I wanted to combine, disseminating information broadly with working with people privately, and so that's the path I took in my career to be able to have social media, I've been fortunate enough to write several books and do a lot of published writing, but then also have my private practice, and I think the culmination of all of that led me to fatty liver and being really compelled by fatty liver. And I think the more complex answer will come out when we talk to it, but the easy answer is what I found is we have fatty liver, which is a common condition, and the resolution and the prevention for which is pretty much a great proxy for my nutrition philosophy otherwise. So as professionals and health professionals, we foster certain philosophies around things. And I just came to the realization that, okay, rather than saying, hey, this is just the most optimal way to eat, or this is a way to lose weight, here's a more meaningful way for me to, disseminate my beliefs and my knowledge of science. So that's really, that's a big part of it. There's more, but that's a really big part of it, if that makes sense.
Totally. Yeah, I would love for you to tell us a little bit what it was like working in public health. I think especially when people follow wellness trends or follow, I'll say like social media health information, sometimes public health gets kind of a bad reputation, even though I'm a pretty big fan of great public health policy and public health programs to help support the masses. What was that like? What was your biggest learnings and takeaway from working in diabetes care and public health?
Yeah, I mean, a few things. I think there's a lot of good people. There's a lot of good people in that industry. You know what I mean? Just it's just a sentiment that I have. So I'll just say that for whatever it's worth. Now, on my end, kind of the work I did was more not directly related to policy. It was more the after effects. So whatever the state of play was, I was working on creating information, education, specifically within Diabetes Canada. So it's in that kind of like protected context where you are, communicating with a lot of other health professionals, nurses and doctors, from the hospitals nearby and so on. So it's really cool. Like, if you ever see the practice guidelines, so Diabetes Canada publishes practice guidelines with best practices for nutrition and, pharmacological care and so on. There's an incredible amount and a lot of insights from smart people that go into that stuff. So I think that would be my major takeaway. And really why I love the idea of, it's why I'm on social media, is I love the idea of being able, and although, I mean, the waters get a little bit murky these days, and of course they do, but it's why I love sharing information broadly. It's very rewarding more than anything else.
Yeah, I think I agree with you. I think, we sometimes underestimate how much science, thought, time, and expertise has gone into those public health guidelines. And where I always want patients to think about is that, the public health guidelines are written that if like everybody followed them, we'd all en masse be healthier, right? They're not written for like your individual taste buds or your individual situation. They're written as a guide that would help the most number of people at any given time, where we achieve individualized care, where we help you manage your taste buds and all the things you like and do not like about food really comes from working one-on-one with a practitioner, where the guidelines are intended to disseminate science like en masse. And so I have that same sentiment to you. I think that there's some like amazing people and an enormous amount of work that goes into those documents, that they are inherently good, right? They're doing good things and helping a huge percentage of people. It's if you're disappointed by what it says in the guidelines, it's because you might need some individualization for you to be able to execute on that guideline or figure out how to make it work for your life. But that's so cool. I love that you have that experience. I always really respect, all of those public health programs, especially the ones that are centered around metabolic health and diabetes. But for fatty liver, I'd like to jump into our like main topic at hand. For most of my patients who were ever assessed and diagnosed with fatty liver, they were often completely shocked about this going ons inside of their body that they didn't even realize was A, possible, or B, happening to them. Can we just walk through like what it is, why it happens, just to kick it off so that our listeners actually understand what it is that we're talking about today?
Yeah, absolutely. I think I will say as well, I think the shock factor associated with fatty liver is another reason which compelled me to get into this area, is because there is something about the liver that really resonates with people, like the idea that it could be less than well. And I think a lot of that is we build it up as the detoxifying organ and so on. So there's extra value attributed to it. But fatty liver, I'll say a few things here. It's a big question, but fatty liver at the end of the day, it just means that metabolically, internally, certain systems in terms of how your body is working with fatty acids are a little bit off, and fat starts getting stored in your liver at small but very consequential levels. And what that means is that, the things that follow, inflammation and so on, damage to the liver over time, can become very, very problematic. How it happens? I mean, look, it's fatty liver has about a 33%, I think, heritability, which means like, for the sake of simplicity, 33% of it is genetic, right? So the rest of it really is coming down to lifestyle, so lack of physical activity, presence of physical activity, the overall dietary pattern. Is it conducive to insulin resistance and high triglycerides? Is it less conducive to those things? And history of antibiotic use could play a role as well, because the gut microbiome and the liver, their fate is very intertwined. So all those little factors come together and determine whether or not your liver was improperly going to store some fat. And just to say, I mean, the human liver on average, I believe, weighs around 3.3 pounds. Only 5% of that, 0.16, 0.17 pounds, has to be fat, right? For one to be at that minimum threshold for a fatty liver. So it's not a huge mound we're talking about, right? So it's these little systematic failings that lead to small accumulation over time. It's not like a massive deposit. So I just say that for what that's worth.
Yeah. So, and how that fat gets there, like, I think that's kind of an important part of the conversation, because I think people sometimes, and when we talk about, fat being stored in organs where it's not supposed to be, or fat accumulating, even we talked about fat accumulating in muscle tissue a couple of weeks ago on one of these episodes, and it influencing our muscle tissue as we age. I think sometimes we imagine that it's like, if we eat dietary fat, it goes into those places, right? That we imagine that it like is an immediate translation into, if you eat fat, if you eat olive oil, if you eat butter, that it immediately is going into your liver. How does it actually happen? How does the fat get there and accumulate there?
Right. Well, I mean, just to say, I made a post on this a few days ago, but a cup of nuts a couple of, let's say, almonds has a similar amount of fat, literally in terms of pounds, that someone with a fatty liver would have to have the initial diagnosis level. So it's kind of, it's very interesting to your point. Well, there's concentric circles, right, that lead to fat being stored in the liver. I mean, very often, insulin resistance is almost always playing a role. Many people think about insulin as the hormone that reduces carbohydrate levels in the bloodstream, sugar levels essentially, but it also reduces levels of fats, right? And if there's resistance to insulin, this is a massive oversimplification, but it's true for the sake of today's discussion. If there's resistance to insulin, there's going to be more fatty acids flowing in the bloodstream, which increases the likelihood they're going to be delivered to the liver, and it's going to be more than the liver can handle, and the liver could store some of those fats, and that process could carry on over time, and then it kind of perpetuates itself because it further screws up the signaling within the liver, right? So you definitely have insulin resistance. Almost always you have high triglycerides, which is just like, for simplicity, it's high blood fats. People think about high blood sugar, triglycerides are high blood fats, and that's kind of not the same thing, but similar to the free fatty acid stuff that I talked about. And then also very often you have, mitochondria not working as well as they should, which means there's further issues. And all of this stuff has to do with the simple idea of the amount of fat going in versus the amount of fat going out of your liver. When that's out of balance, and these factors I talked about all play a role in that, when that's out of balance, that's kind of how you end up with fatty liver. Now, we can talk about the diet side and what some of the simple answers people give, and then how it gets more complex. Fructose does come up a lot, and I can talk about that. But you have all those factors, and then you have the gut microbiome, because the liver and the gut are connected through the portal vein. And when the gut microbiome is not in a good place, it sends less than optimal compounds to the liver, which can cause inflammation, which can overload the detoxifying cells of the liver, and that can lead to, so insulin resistance causes inflammation, but inflammation causes insulin resistance. So it's this constant cycle in perpetuity, all of which the end result is fat being improperly stored in the liver, or your liver not quite making too much fat versus oxidizing and using fat, and all of these little factors. And the balance just goes in the wrong direction at the end of the day.
Do you know what I was dying for when I was a practicing clinician? I wanted someone to summarize the latest research, tie it up with a nice little bow, and deliver it to my inbox every single month. I'm Dr. Jordan Robertson. I'm the host of the Real Integrative Medicine podcast, and this episode is brought to you by my free integrative medicine magazine called The Stacks. We're all dying for unbiased, unindustry-funded information to help us be the best in practice. The Stacks delivers you quality articles every single month on the latest research on things you care about in practice, as well as opinion articles and business advice for integrative practitioners and naturopathic doctors. You can subscribe to The Stacks with the link in the show notes today and get access immediately to all of our back issues that show you exactly how to be an evidence-based practitioner. I hope you sign up and you'll enjoy it.
When I used to work with patients and, we were focusing on things like their insulin resistance, I told you earlier in that episode that they were often very shocked about this, what seemed like an incidental finding of fatty liver on ultrasound. And often if I knew patients were going for an ultrasound for some other reason, and I had high suspicions that they had fatty liver, I would often sort of pre-frame the conversation. If you get these results back before I see you, we're probably going to find fatty liver. And part of that's because, patients often don't have any symptoms, right? It's not like it hurts. It's not like we get this abdominal discomfort if it's happening. What are those early warning signs that there is that change? And how do you suggest that people get evaluated for fatty liver?
Yeah, it's a good question. The most common symptom of fatty liver is fatigue, but wow, what a general symptom to have, right? So very, very hard. Some people will get pain in that area, but this is not the majority of people. It's not that's not a useful predictor, realistically speaking. So then, what I'll say is more broadly, how I look at fatty liver, essentially, it's a sign that perhaps things haven't been done quite right on nutrition and physical activity side. And it's a sign that if one continues down that same path, very likely more problems will occur, which is why we see people with a fatty liver have higher risk of various other outcomes, including certain types of cancer and diabetes and so on. So I consider a harbinger, an early warning sign of things to come. right? And there's grades to fatty liver. So you can have a little bit of accumulation or a lot, depending on how much time passes, and it can get worse for various reasons. But if we think about blood work, and the blood work most strongly associated with fatty liver disease, so there's a few things here. So traditionally, people think of like liver enzymes, ALT, AST, GGT. GGT, what I've seen, is the most predictive. So if I was given 4 liver enzymes, the one that would concern me the most being out of range is GGT. GGT is used in a formula called the fatty liver index. So scientists view it in combination with other things as the most predictive. Liver enzymes, like the most common reason for liver enzyme elevation is fatty liver. But liver enzymes, in my experience, and I've corroborated with medical professionals, like they're a little bit finicky, which is to say, you can have low liver enzymes in a fatty liver, and you could have an individual who has had a fatty liver, successfully reversed it, and still has high liver enzymes. They don't always reflect accurately what's going on. So that there's limitations with liver enzymes there. So then what do you look at? Okay, that's a fair follow-up question. So what I would suggest, triglycerides, ApoB, and HDL. When these 3 are all out of range, the likelihood that fatty liver is either already there or is coming in the next 5 years is very high. And one's ability to reverse fatty liver is impaired when those 3 things are high, right? So this is what I've seen from relatively recent evidence in blood work. So I would pay attention. I mean, insulin resistance, absolutely, right? That's obviously almost always present. So clearly that's a good indicator. But if you want more like fun blood work to explore, those are the ones I would look at. And I think those would be the most predictive in total. Triglycerides
and those are,
one.
Yeah, and I was going to say, those aren't ones that are like that unusual. I would say I don't always have patients walking around with an ApoB that having been tested, unless they have started to unless they've invested and, chosen to do that themselves, or they've gone for some like executive level medical of physical. But the other things that you just mentioned there probably were on your last set of physical exam blood work. And I think where I always want people to be mindful is that, we have target cutoffs for some of that blood work. And only when, things get remarkably bold on your blood work do we, generally start to move towards treatment. We can often see some of these pieces coming on trend years and maybe decades away from you, being congratulated with a diagnosis of elevated triglycerides, or us noticing something that's just frankly out of range, is that we can quite often pair up this trajectory of insulin resistance, which however you measure that, you certainly could do something like a HOMA-IR score, arguable how sensitive that is at this point, but we can see whispers of insulin resistance in your case. We can see, whispers of your cholesterol panel being out of range. We can maybe see whispers of a few other things, including like abdominal waist circumference or abdominal weight carrying, before any of those things are truly out of range. And yet we may have had these small changes that are happening in the liver. How far can someone go down that path and still have the ability to reverse it? It's not very often we get to talk about reversing things. And I love that this is something that can be reversed, but let's talk about when is the best time to intervene, and when does it start to become more challenging to make those reversals before we jump into the nutrition?
Yeah, well, I would say, okay, well, first of all, there's probably not a huge amount of research to make high-level claims about some of the nuance in what you've asked, but I'll try to answer it to the best of my ability in terms of what I've seen. So there's 3 grades to fatty liver, okay, as a starter, right? The first grade, and it goes up by about 30% increments, which say 30% of the liver is represented by fat storage, right? So between 5 and 30% is grade 1. Essentially, what I've seen is with intensive lifestyle intervention, within 3 months, theoretically, you can reduce liver fat content by 1 grade. Now, the reality is there's massive amount of nuance in that, right? Because that is best case scenario. You have an individual going to do things by the book. And, in the real world, people are on a bit longer timelines. To ask someone to do a 180, to check every single box, to do the physical activity required, that's a bit of a stretch, but theoretically within 3 months, you can reverse it by 1 grade. And what I've seen is between 12 and 16 months, you can have the ability to reduce it by 2 grades. But That's on limited evidence. So if to make any claim at all, that's the kind of claim I would make. Now, I guess the bigger concern becomes if you leave fatty liver unaddressed for an extended period. I mean, one of the many bad things that can happen is it can progress into NASH, which is a more inflammatory form where you get fibrosis and scarring of the liver. And then there's less certainty. There's certainly studies which show you can reduce the amount of scarring on the liver, but the extent to which you can and the consequences of that long term, that's less clear. I mean, you certainly don't want to be in that position, and that's one of the many reasons why, if you get a fatty liver diagnosis, that you should take it seriously, right? Because it's not just the other risk factors because when you get a fatty liver, there's all these risk factors that are going on that could cause you many other issues. Obviously the liver itself is going to get worse over time. You get a relatively small percentage of people progress to NASH, and even a smaller percentage of that then progress to cirrhosis or liver cancer. But nonetheless, you don't want to be in that small number of people. Suffice to say.
Yeah. And when we think about it being part of someone's like more complex cardiometabolic profile, right? Like, and I love what you said there, where people really love their liver. And I think that's true, right? Like when something going wrong with your liver, people do have like sort of an affection towards their liver. And if they thought that they were doing something that was having a big impact on it, they would want to know, and they would want to do something to reverse it. But as we, continue to have that, walking down that progression path, and more of the liver is taken up by fat, and it's not able to do its job as well, it starts to influence lots of other parts of that cardiometabolic picture. So, pick your goal, right? Whether it's to prevent diabetes, whether it's to stay off, cholesterol medication, whether that's to manage your weight, whether that's just to feel better, or if it's to fix your liver, like going down that path of like accumulated fat deposits in your liver starts to create a snowball rolling down a hill in terms of like your other cardiovascular risk factors. And so whatever it is that makes you excited or want to do something about it, I think you can like see how connected this particular condition is.
100%. What I'm really fascinated by, and I'm hoping to see in more research, which is not the easiest thing to look into, I suppose, but what are the consequences as fatty liver gets worse? Obviously, the liver serves about 500 functions or more in the human body. So then how are those functions compromised with additional liver fat accumulation? This is a difficult question to quantify, a difficult question to answer. It's certainly something I'm looking out for, because obviously giving that tangible feedback, in terms of, hey, listen, like this is going to, anything requiring detoxification, whether it's of blood, of bacteria, recycling dead red blood cells, which the liver does, to what extent does that compromise as fatty liver gets worse? Like that's something I'm interested in. I've not seen that yet, but that's, certainly there's going to be something there. And part of it, yes, will manifest in diabetes risk and so on. So it's very fascinating stuff.
Totally. Let's talk about the nutrition piece, because, I think there's kind of two sides that I want to address. There's like the over nutrition, right? Meaning being in a calorie surplus and the impact that has in general. But then there's the diet quality component to this conversation that I think is important, especially as there are many trending fad diets that really emphasize a lot of saturated fat. And I think when we think about fatty liver, we often sort of turn to thinking about carbs right away without acknowledging how damaging saturated fat can be. But let's start with the overnutrition component and how influential caloric intake is on fatty liver. What's your experience with that, and where does the research sit with that right now?
Yeah, no, fair enough. I mean, it's for sure the case that when you have, like, into your earlier point, let's go back to the fatty liver index for a second. What does it look at? It looks at waist circumference, triglycerides, and GGT. Okay. So there's obviously, there's a role being played there for, visceral fat accumulation, abdominal fat accumulation, and excessive calorie intake. And, very often, excessive calorie intake in most cases is not excessive calorie intake from salmon and almonds. Sure, there's going to be a subset of individuals who are that perfect storm, but that's generally not the case, right? So, and that's why you often see, and this is where it gets really interesting. I think this is a really important point to make. You often see being put out there that the first step to resolve fatty liver is like 5 to 10% body weight loss, and that reduces liver fat levels and so on. And very often you'll get that advice when you have limited time with a medical professional, they will give you that advice. But really what they're saying is, optimize your diet and be more physically active. And those two things offer the real reward, because what I've seen, and it's important for people to hear this because I do have many clients in this area who, in the absence of significant weight loss, do resolve these issues. So it's very important, because you don't want, if you use weight as the only metric, you put yourself at risk for doing a lot of good things, looking at one metric, not getting the desired outcome, and then maybe giving up on everything, when in fact you are getting better, because at this point, there's ample evidence that physical activity and dietary changes reduce liver fat accumulation in the absence of body weight changes, and certainly in the absence of massive body weight changes, right? There's lots of evidence in this area, particularly as it relates to the Mediterranean style diet, and then, regular moderate physical activity. But it's also true that like people who go down that path, like there will be individuals who also lose weight, but calorie balance is a fine margin. You can have an amazing day of eating, eat a bag of chips at night, and be slightly over your needs. You're still in a great position to live a great life, but you haven't struck the right calorie balance, because, we don't need that many calories. It's easy to eat them. It's hard to get rid of them. So I think these are competing interests that we have to be aware of.
Yeah, that's such a great point, and I'm glad you brought it up. I have a lot of curiosity around what's going to happen with the conversation about diet quality as patients are there more and more patients using anti-obesity medications and appetite suppressing medications, because those medications don't like magically make you want to eat the Mediterranean diet, right? It's like it's non-discriminatory in terms of the foods that it decreases in your diet. I have so much curiosity whether or not people keep their cookies and bail on the salmon. I think we need more research in that area, but I have a lot of curiosity about that, because I'm going to imagine that we're going to start to talk about GLP medications as a solution for fatty liver and not do justice to the diet quality part of the conversation, where there is so much literature. So I'm glad that you brought that up. And for people that are listening that have received that, the figurative piece of paper from their doctor saying just lose weight, and then going home and feeling overwhelmed by that recommendation, or that it's kind of a non-starter because thank you very much. This is 100th time in their life that they've heard this recommendation, but now it's being tied to this new symptom or this new issue. I think that creates a lot of lack of momentum for people to get started with better nutrition when they feel like the only answer is to diet, and they've not been successful, or they don't want to pursue that. So thank you for bringing that up.
No, absolutely. And I'm keenly aware of it. It almost, I would go as far as to say it hurts on a personal level to see someone, misconstrue the benefits of their efforts because they haven't lost some massive, unrealistic amount of weight, which perhaps wasn't in the cards to begin with. Right. And that causes me literally causes me great distress, because, I'm a purist when it comes to nutrition. I do love that. I do believe a lot in the power of food and the unique benefits different foods offer, and how what that does for the gut microbiome, among anti-inflammatory benefits, among other things which fair enough, GLP-1 medications have a role to play in the current context, and that's all good, but they can't do everything. There's a lot of things that only certain foods can offer and certain foods can do, and it would be a shame if someone wasn't able to embrace those things and to get excited about those things, and that's what gets me excited, certainly.
And how do you keep patients motivated? This is a total sidebar question. We're going to come back to the specific nutrition pieces in a minute, but it just, what you said there made me think of, when patients love gold stars in their progress, right? And it's like you said, it can be discouraging if they have assigned weight as the metric that they're tracking as they work on their fatty liver, but then they haven't lost any weight. And does that mean that they're not being successful? But with fatty liver, aside from another scan or another set of blood work or something that, gives you that sort of tangible feedback that things are improving, how do you help your patients stay connected to the change and what they're doing when we don't get that kind of feedback every day?
Great question. Let me just start by briefly talking about scans, because you brought up ultrasounds earlier. Now, there's a more robust liver scan, which is called a FibroScan, which is much better suited to detect small changes in liver fat. So an ultrasound can tell you there's fat in your liver, but if you get one now and one in 3 months, it may not be able to tell you really that well how much it's changed. A FibroScan, which is increasingly available but still not abundantly available, is pretty much, short of a biopsy, which is, very invasive and probably not necessary in a lot of cases. A fibro scan is the best way to measure short to medium term changes in liver fat and liver scarring. So I'll put that out there as well. So that's another thing. Don't rely too much on ultrasound, because you can do a lot of great things. Ultrasound could still show liver fat, but if you have ApoB, HDL, triglycerides, insulin resistance improving, and so I would say to look into those things. So now to your question. Look, clients ask me this all the time. And when I'm with someone, especially for fatty liver, and I have an online course which helps explain this, I really help them to believe in the specific benefits of the foods that they're eating, such that I use adherence to my principles and our strategy as like the gold standard for progress. How closely are you able to adhere and bring to life what we've put on paper? And you can't just say that a la carte. You have to support that with offering them some scientific understanding, like, hey, blueberries have this compound that does this, nuts have this that has this, only fish have these omega-3s. If you don't eat them, you don't get those compounds. So it's really allowing them to believe in the unique benefits of the foods, and then using that as the primary metric. And I do that in combination, hopefully, with some charisma on my end, and also with a strong scientific background, right? That's how I think I get away with it. But yeah, I have this question on daily, and it's a challenging question. It's true, because there's not always abundant metrics, but the reality is as well, for anyone listening, when you make certain changes that are more than likely going to offer benefits to the gut microbiome, to reducing inflammation, you are going to feel better physically and mentally, right? It's almost inevitable. And I very often tell clients, like, we've created this strategy. I'll just make a name, Fred. Right now, you don't know you can't perceive how good you're going to feel doing this until you start. But I know how good you're going to feel. So you have a lot to look forward to. You have a lot of upward mobility. So go after it. Let's see where it takes you. That's not rocket science. Things like this is what we do as healthcare practitioners. But that's a big part of my approach.
I think that's so great. And I think you bring a lot of charisma. And I honestly feel like that goes a long way. I feel like humor and charisma can make people stick to their plan. Or at least that's what I think. Yeah. But it's interesting, like you mentioned that, like, achieving the goals and having high adherence becomes the goal, right? And that becomes, it's almost like the promise that patients are making to themselves to include those foods every single day starts to become the reward, right? Or starts to become the outcome, rather than attaching it to, a particular outcome. Because, and this is where we struggle in nutrition, honestly, is that usually the outcomes we're trying to achieve are like way far away in your life. And we are creatures of like needing a little bit more instant gratification or gold stars, stickers, feelings of success earlier than when we're going to receive a better triglyceride number. Even though they can think like changes can happen quite fast, it's still not so fast that we can rely on that solely as a way to be influential. The other thing you said there that it made me reflect a little bit on my own practices is that, I think I've wavered in times in my career where I would be very prescriptive about food and particular foods. And then moments where I would try for more of this like broad strokes approach to nutrition, and let's work towards like include any of these 8 things. I was curious as you were saying it, I was like, I wonder if that was even as successful as the moments where I said, must eat blueberries, like I think there's probably pros and cons to both approaches, but for this particular condition, knowing how impactful certain specific foods are, I think it really lends itself well to having this like gold star checklist. Let's talk through some of those foods, because I think people will be probably surprised at some of the impact and power that specific foods can have on this condition. Talk us through your favorite research on food and fatty liver.
Yeah, fair enough. So what I would say, if I had to break things down to families of foods that I consider most important, and there's a lot of room within each of these families to find something that people like, right? That's the joy of it. But I would definitely like a fatty fish, as really the only dietary source of EPA and DHA, which are a certain type of omega-3 fatty acid. There's a lot there with fatty liver, and we can talk about that. But so fatty fish is one. Now, obviously, absence of fatty fish you can supplement, so that's kind of an easy one to replace if you have to. So fatty fish is one. Like, look, more broadly, fruits and vegetables. That's not surprising. But then you could dig down. Like, can we pick fruits and vegetables that are higher in flavonoids, higher in polyphenols, which science is showing us perhaps have an above average benefit for liver health, for the gut microbiome. So we'll definitely have that conversation there. Then we'll go to legumes. Now, I'm a big fan of legumes like lentils, chickpeas, kidney beans, and black beans, simply because I think a small amount on a regular basis offers a lot of what people need. I mean, economics and efficiency, yes. Satiation, yes. Magnesium, protein, fiber, yes. A demonstrated influence on the gut microbiome, yes. You know, there's not a lot of foods that you can say that for, right? Legumes check that box, and you only need a small amount for that benefit. So that's big. And then, you know, what people refer to, you know, colloquially as healthy fats, you know, nuts and avocado, right? What, you know, monounsaturated fats they offer, not readily replicated in other foods. You know, we have evidence they lower insulin resistance, lower liver fat, like maybe increase GLP-1 secretion, monounsaturated fats, right? So I have to pick fatty fish, fruits and vegetables with some specificity, legumes, healthy fats. Like, and look, don't get me wrong. There's getting enough protein. There's a lot of other factors that go in. Like, there's a lot of other foods besides these, but I would say these are the ones that are, in my view, the least expendable, right? I could, you know, and we can talk about what I mean by that, but I would say those core group essentially are, I consider to be very important.
Can you just tell us about the legumes for 1 second there? Because we have worked hard on focusing on plant-based protein in some of our podcasts to help people understand, you know, the benefits of making those small changes. When you say a small amount of legumes makes a big difference, like what do you mean by that?
Yeah, well, it's a great question. I mean, on social media today, I just posted a study that I like, and they gave individuals an average of a quarter cup of lentils per day, so 40 grams, which you can even buy in small sleeves online, right? 40 grams, a quarter cup, not likely to cause anyone gastrointestinal issues. I mean, you can't guarantee that universally, but that amount is pretty modest, enough to lower markers of insulin resistance, right? At that amount. And also, granted, legumes per unit are one of the most satiating foods. So even at that amount, I mean, a quarter cup is not going to have, let's call that 5 grams of fiber, 5 grams of protein. So not a crazy amount. But I would say a quarter cup a day would be the minimum threshold where we've seen evidence. But from there, the sky's kind of the limit, you know, and then you have to just reconcile that with the gastrointestinal side and the personal preference side. But if your goal is to feel very satiated at a meal, to have a minimal blood sugar response at a meal, then it's reasonable to look at legumes as like the pinnacle of starchy foods. And that's kind of how I look at them. You know, we're just below that. You can have things like, you know, the quinoa, the sweet potato, and like the barleys and the brown rice of the world. And equally, for people out there who, when I say those foods, I go brown rice, like that's a no for me. Love my white rice. Cool, no problem. Well, you know, if you mix white rice and legumes 50-50, you totally change the blood sugar response. And of course, you still get the benefits of legumes. So what a beautiful thing, right? You still get to eat your favorite food. So their functionality is let's say multifaceted.
Yeah. And I think like my goal with that question, and you did a really great job of answering it, is that like, we want people to be a bit legume curious, you know, that they're willing to kind of dip their toe in. And I think sometimes when you imagine, if that's not part of your cultural cuisine, or you have zero skill or education on how to cook legumes, you end up with this gap where what you imagine a legume included meal looks like, right? Or these like, you know, maybe beautiful dishes that are only those things versus imagining finding a way to squeeze a quarter cup into your regular meal. You know, you don't need to start with this, you know, insane, amazing legume-based dish. It's about getting that like minimal effective dose into your diet more often, which can look like, I'm glad you brought up. That's a hack that I feel like I used to use when my kids were little, and I've definitely moved away from it, is like the mixing the legumes in with the white rice. I need to get back to that.
Yeah, 100%. For the blood sugar buffs, I think like it's between 20 and 35% reduction in like the peak blood sugar response if you do that with the white rice. And these days, you know, I mean, there's so much interest around like CGM and that kind of content does well. So I'm sure people will like enjoy those numbers. But yeah, but I'll say one other thing with legumes, like basically this is how I frame it. As someone's diet quality goes up, it's true, the importance of legumes goes down, I would say. I think that's a fair statement, because it means you're protected against all the benefits, against all the things that legumes might otherwise help you resolve, like they lower blood sugar, lower cholesterol, help with the gut microbiome. So theoretically, if you've been doing things great for a while and you don't like legumes, theoretically, you're going to be in an okay place. But the more help you need, the more let's say expediently, you can acquire it if you incorporate legumes. And in the long term, I mean, legumes just demonstrate human evidence. Legumes increase certain families of bacteria that are associated with many health benefits. So you have to have that bit of long-term thinking as well. And you have to have some belief in the science that's out there and the observations that very smart scientists are making about these trends. And if you don't have that, I mean, it's okay, fair enough. You're not going to value legumes perhaps in the way I think you should.
So can we just talk about the saturated fat, like replacement effect here a little bit? Because one thing I want people to always remember is when we're talking about research and nutrition, it's not just about what foods we're adding, but it is about a little bit about what those foods are potentially replacing in your diet on a regular basis. And I don't mean an elimination diet. So for those of you that are, listening and that are feeling, I don't mean an elimination diet. I mean that like naturally when we increase certain foods, and positive foods in our nutrition plan, it squeezes out some of the other things that either were non-nutritive or were not helping, were just neutral, or the things that perhaps we're actually having a bit of a cost associated with them nutritionally that we don't want, maybe like red meat or hyperpalatable foods, processed foods. So in your opinion, Andy, like where does that conversation come in around like which foods are we hoping get squeezed out of someone's nutrition plan or starting to become less of a focus in their nutrition plan as they're working towards a better liver health?
Yeah, fair enough. Well, I start with a study I think it was published December 2024, American Journal of Clinical Nutrition, using olive oil instead of lard for cooking, 6% reduction in ApoB. So fortunately I saw that study last week, so it's top of mind. So that's a great example, right? ApoB is cardiometabolic for many reasons, but specifically for liver, it's a good predictor of what's going to happen with your liver and what's coming, right? So that's an easy swap. But how I encourage people to look at it in terms of displacement and so on, it's a question of balance over time. I look at nutrition as a game of averages. Most people have had a lot of red meat and a lot of chicken in their life and not a lot of fish. So can we work towards rectifying that balance, right? Increasing fish intake, and it has to come at a cost of another protein source. That's the most obvious one, right? Is can beef and chicken play a smaller role such that maybe fish can play a slightly larger role? That's like the low-hanging fruit argument, the most obvious one that I would recommend. So when you talk about saturated fat, swapping saturated fat for the omega-3 fats, like that's massive. And I'm going to offer another reason why, a little bit more fancy so people can understand. So there's a type of bacteria, and it's not so straightforward to say we can say bacteria are good or bad, but I'm going to oversimplify to say there's a family of bacteria called Collinsella, which are supposed to be bad. Okay, now in people with severe fatty liver, the numbers of these bacteria are much higher. So, additionally to that, I've seen studies where they give people omega-3 supplements and the amounts of those bacteria decrease, right? So the benefits of omega-3s are also potentially because they have influence on the gut microbiome. So it's very fascinating stuff. Anyway, just to kind of say that's the big change. And I mean, and from there, it's tough, right? Because it's tough to say, like, for an afternoon snack, I mean, yes, I would love someone to have like roasted lentils or roasted edamame or nuts instead of a chips or pretzel or a bagel. So that's clearly, if that's the swap at hand, for sure. You know what I mean? Even having dark chocolate instead of a lower percentage chocolate, which saturated fat-wise maybe doesn't change much, but greatly increases your exposure to like flavonoids and polyphenols, which have an influence on the gut bacteria, which have an influence on the liver. So those are the kind of swaps that we're looking at realistically. And again, sometimes it's not even a swap. Sometimes it's just a combination, like not even giving up white rice, combining with beans. You know what I mean? But yeah, feel free to poke me more for specific answers in that area. That was a bit general what I said.
No, I think you did a really great job there. And I think it's a good reminder. Like, I think people are faced with so much crap online, and not the good kind, like the poop kind. We're talking about the bad kind, where like the misinformation and those broad food groups are sometimes villainized in certain spaces. And yet they're the very thing that is improving your cardiometabolic health. And so this just serves as one more very important example of why you should not be on the carnivore diet, despite maybe the weight loss, right? Like, I think just to like circle it back to that piece around, is it just over nutrition or is it diet quality? We'll see people that like are having a great success on a particularly limited diet that is minimizing fruits, vegetables, fiber, legumes, maybe even limiting fish. And But what they have said is their success is that they have had weight loss, right? Or some fluid loss, without realizing that it's like the network of all of those positive nutrients that happen in a Mediterranean style diet or in a, well-balanced diet that actually creates the health outcomes that we're interested in as clinicians. So if you lost weight, but you knew you were not going to live as long, I don't know if we choose that very often, right? But sometimes we're so misguided by that discussion on nutrition online because the fancy thing that gets waved in front of people seems so much more new and exciting than our tried and true discussion around the Mediterranean diet.
Yeah, and there's so much there, right? People get captured ideologically and so on. But I mean, what I always say is, show me the person whose life improved when they cut out lentils and sweet potatoes. Look, there's no disputing there's people who their truth is they've done carnivore from whatever they're doing prior. And I'm gonna guess it wasn't salmon and artichoke and blueberries every day that they switched from. Let's be honest here, it's highly unlikely. I like to know the person who cut out apples and pecans and avocado and lentils and salmon and then went to eat only red meat and their life drastically improved. That's not realistically, that person doesn't exist. If they do, the volume of that in the broader population is so low that it's inconsequential. So it's all relative. What is the individual switched from to be feeling better doing this? Because it's true, you could have a very, I don't like to use this terminology in relation to how people choose to eat, but if you could have a very mediocre diet, switching from which to eating only meat represents an improvement in the short term, let's say. But there are long-term consequences to the gut bacteria. And I'll say one other thing, because we have to look long-term. Of course, if someone's pursuing a restricted diet, they aren't. But one thing I will say, looking at gut microbiome research, so that family of bacteria, so it's called Faecalibacterium, and I may pronounce it wrong. It's all good. So it's been associated. So in studies of the microbiome, people with high levels of this bacteria, which we have evidence that beans increase the amounts, generally have lower levels of inflammatory bacteria from the Salmonella and E. coli family, because scientists believe that this healthy bacteria suppresses their growth. So that's big term, big vision, long-term thinking that, hey, wait a minute, there's this food that increases this level of bacteria, which is going to protect me from other harmful bacteria in the long term, And it's not always easy. Not everyone's ready for that type of looking at nutrition, right? And fair enough, but it's really fascinating stuff for anyone who's into this area and otherwise articulate people who might be tempted. Because look, I'll be honest, even myself, with all I know, it can be compelling when you go on TikTok and not that compelling, but I can see how it can be compelling when you see someone sharing these outcomes, eating red meat, but the unfortunate reality is there are a lot of holes in their reasoning and they dance around the obvious limitations and the changes in their blood work. But unfortunately, most people don't have the ability to just see the obvious gaps in their claims. And it's tough. It's very tough to be an average person. I always say it, who's trying to figure out what to do with nutrition. It's very challenging.
Yeah. And I think the clarity that you provide online, I'd love to hear a little bit more about your course too, but the clarity that you provide online, I think it's just such a calm, rational approach, which I've always really appreciated. I say if you feel compelled and pulled in your social media feed towards drastic change in your life, you probably are following some of the wrong people and should, have a newsfeed that's a bit more supportive or reflective of more moderate change in your nutrition. I mean, yeah, sometimes we need a complete life overhaul, but or there's moments in our lives where maybe, our nutrition has fallen off the rails a little bit, but probably not to the point where we need to, look at some of these extreme diets. And if you're feeling uncomfortable or unclear when you're following people online, I really would encourage you to have a much better, more diverse following so that you feel like you're getting a more balanced view of nutrition in general. But you've done a really good job here, Andy, of showcasing how food can be so impactful for something that is so prevalent in the population. Before we wrap up, you did make a remark about exercise there, and I do want to call it out because I think it's often a missed part of the equation when we talk about that whole cardiometabolic health piece. We'll almost casually recommend exercise. And I actually want people to deeply understand what needs to happen for their movement for them to see change. So what does that look like, the research right now on exercise with fatty liver?
So yeah, how I look at exercise is, let's just say you have an individual who's not doing anything. So for that individual, 5 30-minute walks a week, like brisk walks, so not like the slowest possible pace, that already puts you in a better position to reduce your liver fat content. From there, you can look at 150 minutes or more of combinations of resistance and cardiovascular training. And then there's a little extra something. I saw a study specifically looking at HIIT workouts. And so HIIT workouts basically means, instead of just like running or biking at the same level, you do that and then you mix it with going at a much higher intensity and then recovering, and then generally do it for less time. But you do it's but there's ups and downs for shorter time rather than steady state the whole time. I've actually seen a study where that actually enhanced the functionality of the detoxifying cells of the liver, in addition to offering the other benefits. So the Kupffer cells. So HIIT activity, for anyone who's already more experienced, maybe doing their steady state cardio, I might say doing more HIIT activity could be interesting. But bare minimum, 150 minutes a week, and the minimum of that would be brisk walking. Of course, 150 minutes of anything more challenging, you're going to likely tap into more benefits across the board.
Yeah, I think that's such neat research. I think, I love all the research on exercise, whether it's like resiliency building and sleep and, hormonal health or what have you. But, it's just one more piece that, even if it's in the absence of weight loss, we still have improvement of exercise and improving the efficiency of, all the fuel systems in our body to ensure that we're, those ins and outs. And I don't just mean by calories, but like by, fatty acids, by glucose, actually is working optimally. And if you can smooth out that whole process by adding exercise, you're only going to double your efforts, that you gain through nutrition. So I really appreciate that you brought that part up, because I will forget about the research on exercise and fatty liver and get like solely focused on the nutrition component. So I think that's incredibly important. Thank you so much for this conversation, Andy. Can you tell our listeners how to find you? And also, we'll put all the links for things like your Instagram, et cetera, in the show notes, but tell us how they can find you and how they can learn more from you.
Yeah, I would say easiest way is Instagram and increasingly TikTok. So just Andy the RD on both. And that's where all the information is, links to my course, links to my coaching program, a lot of good information where I just bring to life a lot of the stuff we've talked about today, and just help people understand, hey, this food does all these fun things, right? Just to bring back the positive energy around food and the idea that these things have these unique benefits. That's really what I focus on. Yeah. And so that's what you'll find.
Lots of information and lots of charisma, right?
Yeah, I gotta do better and better on that. But yes,
hey, if you went on TikTok, I feel like that's a win right there. I still have not really broached that platform. Thank you so much for spending the time with me, Andy. I've always appreciated your work online. I think you are contributing in such a positive way to the nutrition education space. We'll put links to all of those things, including Andy's Instagram, in the show notes of the show. And remember to hit subscribe when you're over there in Spotify so that you get alerted when all of the new episodes come out that are great, just like this one. Thanks so much, Andy.
Thanks so much for having me. It's a pleasure.
That's it for today's episode of the Real Integrative Medicine Podcast. I hope you're feeling inspired, informed, and ready to make changes that truly support your health. If you found value in today's discussion, don't forget to hit subscribe, share this episode with someone who needs it, and leave a review. It helps us reach even more listeners just like you. Your health journey is personal and it's powerful. Let's keep building on the knowledge to give you the confidence you need to thrive. It's important to remember that the Real Integrative Medicine Podcast is for educational purposes only. Be sure to talk to your doctor before making any personal health changes. This podcast isn't intended to diagnose you, and no doctor-patient relationship was formed by listening. We'll see you next week.